After getting married, I developed sex addiction, and my husband was exhausted every day. He recommended me to a private hospital for treatment where the doctor used a brush to test my nerve sensitivity. When I was on the verge of collapse during the examination, the doctor finally proposed a treatment plan. The only way to reduce sensitivity is through live stimulation. The treatment plan and the sound of a zipper made me ultimately succumb. My name is Wang Jia, kindergarten teacher. I've always been pure and never imagined I would one day suffer from sex addiction. Less than 10 days after marrying Chintian, he clutched his back and told me he had booked an appointment at a private hospital for me to see a doctor. He was certain I had a problem. I also sensed it, as the uncontrolled indulgence had even caused me some injuries, but the inner flame had not died down one bit. The hospital was secluded, and upon entering I saw only male doctors and female patients. This was the first time I had seen an all-male gynecological clinic. Seeing this, I instinctively tightened my legs. Today, I wore a white dress with short skirts, my legs wrapped in stockings, and my fair skin, so delicate to the touch, made me feel something even when I looked at myself in the mirror. Especially seeing those tall foreign male doctors, I always felt they had ulterior motives. Thinking this, I couldn't help but tug on my husband's sleeve. Seeing me like this, my husband smiled. "Don't worry, this is a reputable private hospital. The doctors don't see gender." With that, he had already brought me to the chief physician. The chief physician appeared to be in his 30s, not wearing a mask, standing at 6 feet tall, dwarfing my husband. And what caught my attention even more were the calluses on his hands and the bulging arm muscles, obviously a result of frequent workouts. In comparison, my husband's posture, clutching his back, seemed rather weak. "Miss, hello, I am Dr. Smith, your attending physician." The doctor greeted me with a bright smile, extending his hand. I hesitated for a moment, then reached out to shake it. But when I tried to pull back, he suddenly gripped tighter. The immense force almost made me cry out, but inexplicably, I managed to suppress it. The feeling of being enveloped by his palm made my cheeks flush a few shades redder. "Miss, preliminarily, I suspect you have sex addiction." Dr. Smith let go of me, his eyes still firmly fixed on me. His expression turned serious, with a hint of oppressiveness that my mind simply couldn't handle. I felt myself slipping. "Next, I will examine this lady, and I would like the gentleman to leave," Dr. Smith continued. I looked at my husband with a plea for rescue. Under Dr. Smith's oppressive gaze, I felt my sickness flaring. I didn't want my husband to leave. But my husband didn't understand my silent plea, and he left, closing the door behind him. "Miss, lie down on the bed, and I will examine you." Dr. Smith stood up, but he subconsciously grabbed my hand. "I'll help you." His tone was assertive, not questioning. If it were the old me, I would have shaken off his hand. But now, sick as I am, I seemed to have no resistance to such dominant men. The pressure from his palm made my neck flush, and I followed his lead, lying down on the bed. Even after lying down, Dr. Smith's hand didn't let go, but he casually explained, "From my experience in multiple treatments, holding a patient's hand can reduce their nervousness. Do you feel less tense?" I was stunned, feeling my palm completely enveloped my face, growing even redder, my heart even expecting. Especially thinking of my husband clutching his back, my anticipation grew deeper. Sensing my off demeanor, Dr. Smith became even more serious. "Miss, control yourself, don't succumb to your illness." With that, he squeezed my hand, causing a sharp pain that made me cry out involuntarily. But this pain quickly turned into another kind of special sensation, and I found myself liking it. Seeing my reaction, Dr. Smith's face became solemn. "It seems, miss, your condition is quite severe. I will examine you now." Releasing my hand, he brought over a tray of sterilized instruments. Besides the familiar speculum, there were also ice cubes and a brush. These, I was stunned, instinctively speaking out. Dr. Smith smiled at me slightly. "These are all standard diagnostic tools. Sex addiction, besides psychological issues, often involves nerve sensitivity. I need to use these to test your level of nerve sensitivity." He moved behind the bed, placing the tray beside it. I hastily clutched the sheets. Could those things really be used for examination? And my condition was on the verge of erupting, yet Dr. Smith seemed oblivious to my state, continuing his explanations. "The brush is better at detecting sensitive nerves than regular instruments. If I touch a sensitive nerve later, just let me know. Your condition is too severe. We need to apply ice to reduce sensitivity after detecting the nerves. Only then can we proceed with the next step of treatment. Otherwise, starting the next step directly will likely damage the nerves. Taking the tray, he looked at me and softly commanded, "Now, miss, I need your cooperation. Spread your legs." His explanation was pushing me to the brink. I never thought that mere words could be so unbearable. My mind was in chaos. The only thing I remembered was that my husband was outside watching me. I couldn't break down. I had to hold on. I had to endure. I couldn't do anything to betray my husband. And besides, the man before me was a doctor, a normal doctor. How could I harbor such thoughts? But the intense need in my mind was indescribable, like a starving person seeing a feast. It was like the thirst after months in the desert. This feeling exhausted me both physically and mentally, my mind nearly breaking. Clutching the sheets tightly, I kept holding back. But the next moment, the doctor placed his hand on my leg, emphasizing his words, "Miss, don't get distracted. We are examining. Now spread your legs. I will check if your nerves are damaged." This time I heard him clearly, but I was somewhat dazed. Instinctively, I spread my legs, and the next moment I saw Dr. Smith take an instrument up. The cold sensation instantly brought me to alertness. Unbeknownst to me, the doctor had already helped me remove some of my pants. I finally regained clarity, biting my teeth to keep from making noise. Looking at my husband was sitting outside playing with his phone through the frosted glass. But is this really okay? My husband is outside on his phone while I, a sex addiction patient, am lying on the hospital bed, my legs pried open by a tall, attractive male doctor for examination. And what's more, with the upcoming brush and ice, I didn't get a chance to think further as Dr. Smith's voice rang out again. "Miss, you need to focus. If it hurts, alert me." As he spoke, I felt a tearing pain, and I quickly said, "Doctor, it hurts." Dr. Smith's hand on my foot paused and stood up, stopping the expansion of the instrument. "It's barely passable. Miss, you need to control yourself next," Dr. Smith said sternly, his eyes devoid of any flirtation throughout. It was all seriousness and pressure, but it was this voice and tone along with what he was about to do, this intense contrast, that I couldn't resist. It was exactly my type. Instinctively, I nodded, and then I saw him pick up the brush. "Don't worry, the brush has been professionally sterilized and can be considered a type of medical instrument. Get ready, here I come." Dr. Smith spoke and crouched down. And in the next moment, I crumbled. "No!" I bit down hard, but the sound still squeezed through my clenched teeth. My eyes widened, but they were devoid of spirit. My hands clutched the sheets, veins bulging. This sensation truly unbearable. "Miss, pay attention. Wake up." Dr. Smith suddenly became flustered, constantly pulling at tissues. He even slapped my leg, the sting searing through me, but it only intensified the collapse of my nerves, as if awakening some special trait within me. He saw my disheveled state and instinctively wanted to stop the examination. "Don't. Doctor, please continue." I could clearly see a flash of panic on Dr. Smith's face. Perhaps he had never encountered such an eager patient. But still he shook his head sternly. "Miss, we are just treating you. You need to control yourself." With that, he reached for the ice cubes to cool me down. I felt a wave of chill spread over me as he placed the ice on my skin, snapping me back to reality. Once alert, the endless shame flooded in. What on earth was I doing? It was all the sex addiction's doing. But at that moment, I saw a veiled heat flicker across Dr. Smith's face. Even though he was restraining himself, I could still hear the shift in his tone. "Now we need to start the treatment," he said, and to my shock, he began to take off his coat. Beneath, he wore only a vest, his perfect proportions laid bare before me, looking so tempting. I was stunned. Wasn't the treatment over? But before I could even react, he spread my legs with both hands, and the sound of a zipper echoed. "The treatment, it only starts now." In the nick of time, I snapped back to reality and couldn't help but scream out, "Husband." Next thing I knew, my husband burst in from outside. I tried to get up in panic, but the doctor restrained me. "Miss, you cannot move during the treatment." Dr. Smith's voice was stern. What treatment? He wanted to do what to me? My thoughts jammed as I noticed a huge machine beside Dr. Smith, which he seemed to have been moving around rather than doing something to me. In an instant, I began to crumble. Had I misunderstood him? "Miss, I understand you misunderstood because of your condition, but this is a machine for treating sex addiction." Dr. Smith's gaze was frank, his sternness melting slightly as he spoke. Clearly, Dr. Smith hadn't done anything to me, and my husband came forward, gently taking my hand. "Wife, don't be nervous, relax." I nodded uncertainly, but then Dr. Smith was clearly about to. Afterward, my husband didn't leave, and Dr. Smith's treatment was by the book, which made me doubt myself. Was it just my own deep feelings that had conjured a delusion? I seemed to have genuinely been interested in Dr. Smith, and the thought made me feel guilty, as if it had been all an illusion. The treatment that followed was rather dull. The machine didn't need to touch me. It used a kind of light to reduce nerve sensitivity, as Dr. Smith explained. But the mental aspect was also important, maintaining a good mood and finding things to do. This illness can't be cured in one go. It requires at least 3 to 4 courses of treatment. You can come back in a week. Dr. Smith smiled as he spoke, and after the treatment, his smile seemed more frequent. He appeared gentler, more attractive even. "All right, darling, take care. I'm off to work." Back home, my husband offered little comfort before hurrying off. To my surprise, the treatment seemed to have an effect. My needs lessened significantly, though I still often had urges, making my husband groan, but it was much better than before. "Dear, it seems Dr. Smith's treatment is very effective. Don't forget to go for the 2nd course of treatment tomorrow." My husband spoke softly, holding me. I looked up at him in surprise. "Aren't you coming with me?" A hint of apology crossed his face. "Tomorrow the company is entertaining an important client. I have to be there, so you might have to go by yourself for the checkup tomorrow." "Don't worry, Dr. Smith is the best doctor in the hospital. He will surely cure you." My husband seemed to misunderstand me, rubbing my head as he spoke softly. I couldn't argue with that, but still I was subtly worried after last time. Even though it turned out Dr. Smith was actually treating me, I couldn't be sure if he hadn't harbored other thoughts in the process. Especially since I have sex addiction, the treatment itself inherently carries a tinge of ambiguity. Just because he didn't have thoughts last time doesn't mean he won't next time. Seeing I didn't respond, my husband seemed to know what I was worried about and immediately said, Okay, let's do this. Check if Lee Hu is free to accompany you." Lee Hu? My brow furrowed slightly. He was my husband's best buddy. They were like brothers. But I didn't like this man. During our wedding a while back, he was the most raucous, and at one point, I wasn't paying attention. Someone even tried to reach into my wedding dress. Although I stopped it, it gave me quite a scare. Sadly, I didn't see who it was, but I suspected it was Lee, who, seeing my husband's distressed look, I finally sighed. "It's okay, I can do it myself. As long as you're not jealous with a male doctor," I said playfully. But my husband just held me tight, stroking my head. "Sweetie, what's there to be jealous of? Doctors don't differentiate between men and women. Nothing will happen." I nodded, then my hand slowly caressed his body. His face changed. He gave an awkward laugh, and then under my resentful gaze, he quickly ran off. My heart ached. I was a conservative woman, but this illness, that indescribable longing constantly surrounding me, made me utterly miserable. The next morning, my husband got up early for work. With just me and my husband at home, I didn't think much of it. I woke up in my silk nightgown, stretching, planning to go to the bathroom to freshen up. But to my surprise, there was a man in the living room. Lee Hu. I jumped in shock. I didn't expect to find Lee, who's sitting in our living room. Actually, Lee, who is quite handsome, the typical Korean oppa with a gentle beauty. His round face always wore a faint smile, his style trendy, completely different from my husband's. "Sister-in-law, you're awake. Chen asked me to come, said to accompany you to the doctor today." Lee Hu stood up, scratching his head like the boy next door. But his gaze continually appraised me. Only then did I realize I was wearing a silk nightgown, one I had bought specifically to seduce my husband, the semi-transparent purple silk revealing my slender figure. At that, I hurriedly turned to go, changed. Lee Hu's boyish appearance was surely deceptive. He changed girlfriends like clothes, especially on our wedding day. Those hands had always been a thorn in my side. Although I couldn't confirm those hands were Lee Hu's, I could never shake the suspicion. His gaze seemed clear, but he was always sizing me up with a side glance. I could feel the heat in the depths of his eyes. I changed into a more conservative outfit, but for the convenience of treatment, I still wore a dress. It was summer, and my smooth legs were bare under it. The delicate feet, crystal clear, were slipped into a pair of sandals. I found myself reluctantly dialing my husband's number from inside the house. "Lee Hu is free today, and I worry about you going for the checkup alone, especially with a male doctor, just like you said." My husband kept explaining over the phone. In the end, I gave in. After all, since Lee Hu had already arrived, it wouldn't be right to send him away. Sister-in-law, you've become even more beautiful. Li Hu's eyes sparkled as he thoroughly sized me up after I changed my clothes. Such lovely skin, sister-in-law. Chin really knows how to take care of his wife. He slowly approached, examining me closely. Seeing no reaction from me, he even moved closer. The distinctly masculine scent overwhelmed me, suddenly filling me with panic. I heard from Chun that your condition is quite serious. You have to persevere through these hospital visits. Otherwise, I wouldn't be able to face Chen. Li Hu spoke, but his words filled me with indignant shame. What did he mean by that? Let's go, sister-in-law. I'll drive today. Li Hu didn't wait for my response, continuing to speak. I remained silent for a moment, sensing something sinister in both Li Hu's words and his gaze. So, I deliberately chose to sit in the back seat after getting into Li Hu's car. Sister-in-law, aren't you going to sit in the passenger seat? Li Hu reminded me with a smile. I shook my head. I prefer sitting in the back. After saying this, I no longer engaged with him, wanting to keep my distance from Li Hu to avoid any misunderstandings. At the same time, I felt somewhat resentful towards my husband for sharing everything with Li. Clearly, he knew about my condition, occasionally glancing at me with a peripheral gaze filled with malice that made me instinctively tighten the grip on my dress. Sister-in-law, what perfume are you wearing today? It smells so nice. Li Hu tried to make conversation, but I didn't want to engage, remaining silent. Yet Li Hu didn't seem to feel awkward at all, continuing to speak on his own. Sister-in-law, what exactly is sex addiction? I'm really curious. Is it like you're thinking about it all the time? I kept silent, feeling somewhat disgusted by his tone, which carried a teasing implication. Sister-in-law, tell me, during an outbreak of sex addiction, can you not help yourself? Li Hu kept talking, constantly glancing at me through the rear-view mirror. I could see the lust in his eyes. I really wanted to call my husband and tell him everything at that moment, but I knew he wouldn't believe me. Just like during the wedding shenanigans, when I told him someone had reached under my wedding dress, he didn't believe me, saying I was too sensitive and questioning how someone could do such a thing to me. Finally arriving at the hospital, I let out a deep sigh of relief and dashed out of the car like I was fleeing. But shockingly, as soon as Li Hu parked the car, he immediately grabbed my hand. What are you doing? Feeling the strength in his grip, I tried to break free, but was utterly unable to.